Now, after having a fatal heart condition, you need to make sure you rehab safely. That's where Moon Physical Therapy comes in. They have a cardiac rehabilitation program that caters to each patient's situation and ability.
Yes, and in today's Living Healthy, we'll meet a man who had a fatal heart condition but is now back to playing golf and basketball, all thanks to his rehab program.
One day I was golfing in a golf tournament, felt some pain in my back, ultimately ended up on the ground, felt a little bit better after that, actually golfed one more hole, but at the end of the hole I just realized something was wrong and couldn't really put a finger on it, but wanted to just go and rest. A friend of mine eventually convinced me maybe I should go to the hospital. We go into the hospital, they triage me, everything's fine, my blood pressure's fine, my EKG's fine, but I'm still having this residual pain in my back. So the emergency room physician says, okay, I'm really concerned about that, let me send you for a CT scan. The doctor comes back and she eventually tells me, you're gonna have to go in for emergency surgery. And I go, okay, when? She goes, right now. They're prepping the room. They've called the doctor already. It's going to happen. There's a 95% chance, if you go home, that you're going to die in the next 48 hours. After the surgery, I was just wiped out. I couldn't walk 20 feet. Wow. So after a couple of months, my doctor said, okay, look, you're never going to run a marathon, but I'd like to try and get you into better shape. So he referred me over here to Moon Physical Therapy. Julie gave me this individualized assessment, and part of it was land, part of it was on the pool, and the pool was just great. It's something where I was able to do and kind of get back to normal in terms of exercising and feeling like I'm actually active and being able to walk and being able to, do some strength and some conditioning at the same time. And, it was just something where I felt very fortunate to be able to be referred here and come over here.
So when Paul first came to me, he was pretty weak. I performed an initial evaluation on him to determine what his needs and limitations were. And then we designed a program specifically for his condition, and we worked together to determine what his goals would be at the end. Our facility is pretty unique because we have the option to do land-based or water, and so when Paul came to us, he was pretty weak, started him off in the water, and then progressing to land-based, all while monitoring his vitals. A cardiac rehabilitation program is a medically supervised program which helps people recover from heart attacks, heart surgery, or any other cardiac conditions. So it's exercising safely, it's watching their blood pressure, we teach them how to monitor their own heart rate, their intensity levels during exercise, we teach them how to recognize any adverse reactions to exercise, how to warm up and cool down properly, and then any stress reduction or relaxation techniques. Our goal is to empower and educate patients so that they can exercise independently and safely, they can understand their condition a little bit better, and reduce any risk factors in order to prevent any future cardiovascular complications, such as a second heart attack. There's been research studies that show it actually reduces the risk of people ending up in the emergency room for a second time if you go through a cardiac rehab program. People that need cardiac rehab, it's basically people of all ages with cardiac conditions. So whether you have had a heart attack or are going under surgical procedures like a pacemaker implantation or a stent, bypass surgeries, if you have high blood pressure, it's good. Coronary artery disease, perfect for that. To really get a workout while you're monitoring their vitals, especially for Paul, I designed a program where he warmed up, did some really great stretches, and then we would, when he was on land, we put him on the recumbent bike to exercise his lower extremities while monitoring his blood pressure. And you can do that while he's on there, and then as he was progressing, he was actually able to maintain his blood pressure within normal limits as I was progressing his resistance or the duration of whatever machine that he was on. So he was actually able to make a physiological change in his heart, basically, and it actually allowed him to go back to whatever he wanted to do, whether it was basketball or golf.
Wow. Wow, hearing Paul's story, it's so scary.
Yes.
It's so important. You got to listen to your body, right? If there's any kind of pain, seems suspicious to you, you got to check it out.
Absolutely. And, having rehab like this, it's so vital to having a quick recovery. So this center there is doing a great job with that.
They are, absolutely.